I'm Kayode Dada from University, OAU here in Ileife. My PhD thesis was centered on application of cell mechanics in medicine. So, next slide, please. So, these are the basic terms used in the research. We all know cells, tissues, mechanics. Then the new term that we are now using is what we refer to as the cell mechanics. Then we know or understand what medicine is. As we all know, cell is actually the basic unit of life upon which all other things are actually built together to form. From the cells, we have the tissues. From the tissues, we have the organs, then the organ system, up to an organism. So like I have on the slide, the tissues are actually a collection of cells which have similar functions. And also as physicists, we understand that mechanics is an area of physical science that actually deals with energy and forces and how these two relate with each other. Like you will see from the slide, from the topic, we'll be discussing cell mechanics, which is actually applying, please, the previous slide again. Okay. We'll be applying mechanics to study single cells. So actually we have cell mechanics, we have tissue mechanics, but for cell mechanics, we always talk about this whenever we are discussing issues on single cells. But if you are looking at it from collection of cells, that is when you look and study what we refer to as the tissue mechanics. So, and we all know medicine actually is an art and also a science which involves maintenance of our health, prevention of diseases, and then if we have diseases, how do we provide cure to that? This cell mechanics in medicine actually falls under the detection part. And if we look at it very well, for example, my MSc thesis was centered much on radiation protection, which is actually what most medical physicists, especially in Nigeria, do. Because most times when I ask myself, who is a medical physicist, we normally say they use principles of physics to study the issues in medicine. But unfortunately, what we have in Nigeria majorly is medical radiation physics, of which almost everyone deals with radiation. And when we look at the effect of radiations in the body, we realize most of these are based on biochemical assessments, which sometimes can be molecular when it involves the structures, chemical structures of cells. Sometimes it may be cytochemistry. We use immunochemistry sometimes to examine all these cells and tissues. Also, like you had earlier on, you've been taught about ultrasound system, which actually uses high frequency sound waves for creation of images, and sometimes we use them for therapy, especially to break kidney stones. Also, one major aspect which we normally use for clinical assessments is the electromagnetism, which I think it's a basic physics for most of us. And under this, we have the use of ECG, also radiology, and then the rest. The next slide, please. So cell mechanics actually falls under two major categories. We have microscopic events and also the microscopic aspect. And one of the microscopic events which we normally study are the adhesion of cells, how elastic are they, and how can all this affect the way they move. And from previous studies, we realized most cells are actually viscoelastic in nature. And then for the microscopic events, we have the mechanosensing. Here, mechanosensing just simply means when you apply a force a mechanical force to a cell, how will it be able to sense that and produce some biochemical changes? The next slide, please. So cell elasticity, which I believe is also basic to physics, can actually be studied based on looking at the stiffness of the cells, and this majorly can be seen, especially when we when we examine red blood cells. We know how blood cells actually normally flow within the vessels, and this aspect is where physics can also come in, now applying the elasticity of the cells to examine the health status of the red blood cells. This can actually be noticed clinically from sickle cell patients and normal patients, that is, patients with normal erythrocytes. And the issue here with the cell elasticity of for sickle cell patients is whenever this red blood cells passes through the vessels, normally it should be able to change from that by concave shape to something like a bullet, so that once it passes through the vessels and it reaches the other end, it can change its shape again. But unfortunately for sickle cell patients, their cells, the erythrocytes in their blood are actually stiff. And when it gets to the blood vessels, they find it difficult to actually move in through. And when this happens, we always have what is called crisis for the sickle cell patients, and they have to look for maybe some drugs or a way to make sure that the bloods are less stiff so that they'll be able to migrate through the vessels. Next slide, please. So like I said earlier, mechanotransduction basically means mechanisms by which chemical signals are generated in cells when you apply mechanical stresses. Stresses are just when you apply force to a particular area of the cells. And after you apply this stress, it may actually come from surrounding cells, because cells are actually attached to one another, and also they may interact with the extracellular matrix, which is actually the environment that surrounds each cell. So when you apply a force to a cell, then you want to examine the chemical changes in those cells. That is what we actually refer to as mechanotransduction. Next slide, please. So examples of current experiments under mechanotransduction is when you apply a shear stress. Actually, like I said earlier, the laminar flow, when the blood flows through the vessels, some of the things that happen there is that you'll be able to sense the mechanical properties, and also you'll be able to use that method to examine or regulate the genes of the cells. And then we have other things there. You can actually stretch a cell. An example of a cell you can stretch is all these truncated cells, especially cells of the muscles. When you stretch them, you'll be able to understand how they respond and the changes they can actually produce in the tissues or in the individual cells. And like I have on this table, you can actually consult the reference of there so that you can get the full details of this experiment. The next slide, please. So basically, for cell mechanics, what we actually need to understand are some of the instruments that we normally use, some of the techniques we use. We have the cell poking, we have the optical tweezers. We can also use the micropipette aspiration, but for my own experiment, I used the atomic force microscope, which is very easy to understand, and also it is very simple to work with. So I will, with for the rest of this presentation, I will talk more on the technique that I use, which is actually the atomic force microscope that I have there. Please, the next slide. So this is just from the basic preparation of the cells to how the how the facility actually work, the technique work rather. So from the left-hand side here, we have, you can actually grow your cells. For my research work, I used cell lines. I used brain cell lines, which were actually grown on mica, and then I placed them on a substrate, after which I was able to measure them using the atomic force microscope. And the basic principle of this is you have a cantilever. I'm referring to the image on the right-hand side. You have a cantilever, you have a photodiode, and then a feedback mechanism, which can actually be used to control the movements of the cantilever. And then you have a laser beam, which is going to be incident on the back of the cantilever. And when this cantilever move closer to your sample, what normally happens is that it will interact. You have a tip at the front of the cantilever. And what happens is when this tip interacts with your sample, there is going to be van der Waals force of attraction that is going to happen between the tip and the sample. And as the tip is sample interaction occurs, there will be deflection of this cantilever. And like you see there, we have the incident ray on the back of the cantilever, and which is going to be reflected back onto the photodiode. And as the tip move closer to this sample and it moves back from heat, generally you will always have some interaction, and then you have the deflection of the cantilever. And normally this is what you are going to have at the end of the day. Let me move to the next slide. You have something like this. Normally from the atomic force microscope, you have the force distance curve, which is actually the force between the tip and the sample, and then the distance between the tip and the sample again. But normally what we use to measure is the deflection of the cantilever, not the distance between the tip and the sample. So the equation I have on the left-hand side is what you can actually use to convert between all those terms. And from what I have there, we have the basic physics that we normally use, which is actually the Higgs law, which explains the relationship between the force and the cantilever deflection. So you can also use this to understand the distance between your tip and your sample. Then after you're able to put all this into use, you're going to have what we call the Earth model, which I have below, which I have on your left-hand side there. So once you plot this, you'll be able to get your force distance cover. Normally, the raw data is what I have on the next slide there. So normally, the raw data is what is below, and then what you have above it is what we call the force distance curve. The one beneath this is the deflection curve. So we have a simple principle we normally use. You can use the formula I have down there. And once you use that, you will have some points that we can actually use to correlate the two of them together. So when you have that, and then you are able to fit in your results into the Earth model, from the Earth model rather, you can get your Young's modulus from that. And the Young's modulus is actually a function of the stiffness of the cell. And when you're able to get your stiffness out, you'll be able to understand if your cell can actually move through maybe the vessels or whichever way it is going to pass through. And then the next slide, please. So this is the flow work of how the atomic force microscope works. What we have on your topmost left is the instrument, and then you can see the cantilever there and how we're able to move this. The AFM also has an optical microscope that will actually help you to look at the cells that you want to image. And once you're able to see the cells very well, you can control your cantilever on top of that particular cell and carry out your indentation experiments. Normally, you can also use the IPEM to get the surface morphology of your cells, which is what I showed on your right hand side. Not only the morphology, like I said earlier on, you can use it to understand the stiffness of the cell by examining the Young's modulus, as I explained earlier on. The next slide, please. Next slide. So what are the basic applications of cell mechanics? Like I said earlier, we can use it to assess the erythrocyte, that is the mobility or the motility of erythrocytes in blood vessels, which is simply that you can take a blood sample from a patient, then you carry out your indentation experiment. Through this, you'll be able to understand the rate of flow, possible rate of flow of that cell in the blood vessels. And also from this, you can use this flow or this motility to understand some novel drugs that we normally use for treating sickle cell patients. Also, you can understand the adhesion and migration of cells, especially during wound healing, because once you have a cut on your body, cells will have to move in order to cover the open places. So you can also use cell mechanics experiment to understand the rate at which the cells move from the normal site to where the cuts or the wounds are. And as I explained earlier on, you can also use this to understand how cells respond to forces. And generally, like we have in medical physics today, we are concerned about cancer treatment. You can use cell mechanics actually to understand the metastasis of cancer cells, especially if you want to understand where the cells should be after treatment. So what you just need to do is get a biopsy of the tissue, then you can actually use your AFM to carry out your indentation experiments, which can be done, like I said earlier on, you can examine the stiffness of the cell. When you understand the stiffness of that particular cell, you will be able to predict if the cell is going to metastasize to a new site or not. So the next slide, please. So the advantages and the limitation of the experimentation, you can actually use your AFM. These cell mechanics can be done on any sample. You can either use them based on their physiological state, that is, especially if you work with cell lines, those that normally do cell culture, you can use it that way, or you can just cut a tissue and then image it. It is actually very simple, especially to use. Also, the sample preparation is very, very easy, unlike the conventional methods that we use in medical physics and or the one we use in optical imaging. So it actually has a high spatial and temporal resolution, and this technique is also non-destructive. You can reuse your sample again, especially for those that do cell culture. You can do your indentation experiment. Then after that, you can allow yourself to continue to grow. But the limitation we have with this experiment is that they are only best for surface studies. You can actually use them to as throughput experiments, and the time for you to get an image or to get a measurement out, it's around 10 to 15 minutes, which I think is not the best for now. Although we have some new AFM that are coming into place, which are dedicated for biological experiments, and this can actually be used for them. And then the last slide, which I have there, is the future clinical relevance of cell mechanics, which I think is one of the major reasons where we have this school, which I believe students at undergraduate level can also look into. You can actually use this cell mechanics to understand the potency of novel drugs, especially for sickle cell patients. Also, you can use this technique of cell mechanics to understand the possible metastases of newly tumor biopsy. As for what we have clinically today, I don't think there is any place where we could predict when exactly a cancer can reoccur. So if we're able to invest more on cell mechanics, it will actually help us to predict. For example, if a patient reports for surgery today and we're able to resect the tissue, the tumor from that, then if you do your cell mechanics, you do identification experiments on that, you'll be able to tell the patient, okay, in the next so months, you should come back to the clinic so that there is a possibility that the tumor cell might have migrated to a particular area of the body. So also we can use this to detect malaria-infected erythrocytes because from some previous studies, we have it that the shape of malaria-infected red blood cells are actually different from the normal one. Also, lastly, from what I have here, we can use this cell mechanics to be a complementary technique for radiobiology that we are all used to. Because if you talk to anybody in physics, okay, what is radiobiology? People normally ask, what is the physics aspect of this? So we can actually incorporate cell mechanics and radiobiology together so that at, at the end of the day, we'll be able to understand better cell metastasis and the effect of radiation on the tissues of the body. I think that should be the last slide there. So I will be open now for questions and answers will be given from me